Good afternoon. I want to talk to you about iodine. So I've been selling iodine for 9 years in my practice. I started taking iodine myself, I think in 2014, or could have been 2000. Yeah, somewhere in there. I've been taking iodine a long time. Take it pretty consistently. Anyway, I have a lot of experience personally with iodine and with patients. I've given it to almost every single patient, with only a few exceptions if I felt like they were going to be reactive, and most patients aren't. The reactions I have seen are mild, just kind of makes you feel a little worked up, okay? But I wanted to show you this, so the inspiration for this video. This is a box of iodine I just finished off. So I sell a lot of iodine. The product I use is from TPCS. It's called Iosol. This is what we call a legacy product. It's somewhere between 80 and 100 years old that's been used. So there's a lot of history with this product. It's the only iodine that I use. Okay, so what are the benefits of iodine? If you said thyroid, nice work, but there are a lot more benefits than just the thyroid. So I want to start with the other ones, and then we'll come back to thyroid, okay? So I was learning a little bit of new information as I was reading Dr. Jerry Tennant's book, despite having used iodine for the past 9 years with my patients. So iodine, it says every gland in the body that secretes something needs large amounts of iodine. Iodine is the truck that carries the secretion from inside the cell to outside the cell. Thus, most cysts in the body are due to iodine deficiency, as the secretions are accumulated inside the cells to form cysts. So that goes for just about any endocrine gland. They mentioned salivary glands, breasts. So a lot of women get cysts in their breasts. Okay, ovaries, even skin, pancreas, adrenals. So all of those glands need iodine in order to secrete their carry out their functions, secrete their hormones or whatever it is. So I see two consequences there if you don't have iodine. One, you're not getting the benefit of that hormone or that function of that organ or gland. And then two, you end up with cysts, which can be either unsightly, uncomfortable, or very painful and can send you to the hospital. So it's really important to have plenty of iodine for that reason. The other next reason, this one is one of the main reasons I have used iodine. It says iodine kills all single-celled organisms like viruses, bacteria, fungi, and protozoa. So iodine is the principal chemical immune agent in the body, and the way he describes it is that it creates an iodine shield around infections. I don't know if I actually love that terminology, but it sounds cool. But really, iodine is concentrated in areas of infections so that it can destroy that infection. It's also preventative. So you sweat iodine. Iodine is in all the mucous membranes, so it's in the your mouth and your nose, your sinuses, throughout the gastrointestinal tract, the urinary tract, the lungs. Okay, so when you have that iodine you're secreting, then you have resistance to infection, and so that's quite valuable. And if you're not utilizing iodine, then you're putting an excess heavy burden on your immune system, and then you're going to run into problems there down the road as well. Okay, so iodine's used for the immune system. Iodine is essential for brain development, and may even be involved with ADD and ADHD. To me, the line's a little blurred here because you can have mental disabilities from a hypothyroid, and especially while you're in the years of development. But anyway, hypothyroid and iodine deficiencies can lead to brain dysfunction, intellectual impairment. Okay, and then the last one, we do got to hit on thyroid. Let me just make sure there's not anything other big ones. I think that pretty well covers this. So yeah, of course, you need iodine for your thyroid, but only about 2% of iodine that's in the whole body is in the thyroid. You have 98% of function that is going to go to the rest of the body. So it is essential to make thyroid hormone, and it is one of the most important. Everything I've learned about thyroid is one of the most important organs in the body. It regulates metabolism and voltage in the body, because your body is electric. It maintains the electric voltage in your body. So there's just a ton of benefits to iodine, and unless we have a contraindication, then you really should be taking some form of iodine. It's very hard to get from your diet. Pretty well the only dietary sources are from eating sea vegetables or the heads of fishes, like if you made a head fish soup or stew, because the iodine from their thyroids ends up in the soup. Most people are unwilling to eat fish heads, and probably not eating a whole lot of sea vegetables. I've not encountered a readily available source here in Idaho of great sea vegetables. So so you got to take iodine, and I haven't seen strong. It's really like case by case basis by who shouldn't take it, but you could start off with just a drop of the TPCS iosol. I work up to as much as 12 or even 15 drops, and it's a pretty high dose product. But again, case by case, I do different doses for different people. So yeah, I hope you'll take taking iodine seriously. I of course do have a lot of patients complain about the taste. It has a terrible taste, and you have to get over that, unfortunately. Most people put it in water, and so they just take it with their water. But I think the secret weapon is to put it in your yogurt if you're eating yogurt on a regular basis and you can't taste it at all. But whether you like it or not, you got to get it in your body. Life is not possible without iodine. It's an essential mineral. Okay, that's all. Thanks.